untreated heartburn or acid reflux can lead to cancer, which is pretty crazy. If you want a way to force your body to permanently stop acid reflux and heartburn in 48 hours, click the link in the description below. For now, let's get to today's question.
The question, heartburn how frequently for Gerd? Answer by Gerd. When the contents of the stomach move backwards into the esophagus, this is known as gastroesophageal reflux disease or Gerd. Since the stomach makes the acid to help a person digest food, gastroesophageal reflux is also known as acid reflux. Almost everyone has this type of reflux at some time. Often a person is not even aware that this is happening. Sometimes the reflux causes the stomach burning sensation that most of us occasionally feel. But even though many people have heartburns from time to time, this does not mean they have Gerd. When a person has Gerd, heartburn or other symptoms occur much more often and cause serious discomfort. Symptoms of Gerd involve many people, including pregnant women, suffer from heartburn or acid indigestion caused by Gerd. Since heartburn is a symptom of gastroesophageal reflux disease, heartburn is a mild to severe chest pain usually occurs after a meal. Heartburn is often confused with heart attack pain, but the heart has nothing to do with the pain. Answer by Rory Malone. The terms heartburn, acid reflux, and Gerd are often used interchangeably. They actually have very different meanings. The term heartburn is misleading. The heart actually has nothing to do with the pain. Heartburn occurs in your digestive system, specifically, in your esophagus. Heartburn involves mild to severe pain in the chest. It's sometimes mistaken for heart attack pain. Heartburn no more. TM. A circular muscle called the lower esophageal sphincter, LES, joins your esophagus and stomach. This muscle is in charge of tightening your esophagus after food passes to the stomach. If this muscle is weak or doesn't tighten properly, the acid from your stomach can move backward into your esophagus. This is known as acid reflux. 24-hour impedance probe study. This study involves inserting a flexible tube into your nose and advancing it into the esophagus. The tube has sensors that can detect if acid is refluxing past the esophagus. The acid can also cause a change in the cells in the esophagus over time. This is called Barrett's esophagus. About 10 to 15% of people with Gerd will develop this condition. Barrett's esophagus increases your risk for a type of esophageal cancer known as adenocarcinoma. Experts believe that most cases of this type of esophageal cancer start from cells within Barrett's tissue. Also, if you are overweight, taking steps to reduce your weight can help. This includes healthy eating and exercising whenever possible. If you are not exercising regularly, a good goal is to strive for 30 minutes of exercise 5 times a week. Antacids. First-line treatments for acid reflux are usually antacids. These medicines act quickly to reduce the effect of stomach acid, which can relieve symptoms. Examples of these medicines are Tums and Rolaids. H2 blockers. H2 blockers are designed to reduce the amount of acid a person's stomach produces. Sometimes taking these medicines with antacids can help. Examples of these medicines include proton pump inhibitors. These medications work longer than H2 blockers to reduce acid in the stomach. They can also help heal the stomach lining. Examples include prokinetics. These are medications like metoclopramide, Ritalin. There is controversy as to whether these medications benefit people with Gerd. Many new prokinetics have been removed from the market due to serious side effects. Answer by Rajinder Bala. Google Depakote and dehydration. It causes dehydration. In fact, all medicines given for psychological reasons cause dehydration as drugs of abuse in trace form. All such drugs cause dehydration that causes fluid imbalance in the body. Feeling heartburn at that time is normal. 16 to 17 years is long enough period to have healed any side effect that were caused at that time. The following info will help you get rid of acidity, GERD, at any time. Hydration. Dehydration cycles flush out all toxins from body. As such, there is no reason for you to worry. Curing acidity, GERD, kidney stones and subsequent acidity. I had kidney stones for 3 years in a row. The stones were small and I went to doctors in time. The stones were removed by giving diuretics, antibiotics, drips of saline water and muscle relaxants, through urine. This was shocking. I was an all-rounder. I was a sports person who would love to play any game that was going around. Sports was my first love. We were taught that sports is good for health. The doctor told to drink 6 to 8 liters of water daily. After first year kidney stone I took special care to drink enough water, but in spite of that I developed kidney stones. I was confused. I was worried. Around this time, I suffered from acidity. I could hardly eat anything. Even if I drank water, I felt that I was full up till my throat. I could not tolerate any spices or oily food. I took antacids, injections, medicines. I took a lot of care in deciding what I should eat. Nothing worked. Every passing day the things were getting worse. There was no improvement. I stopped taking interest in business. I started studying health-related matters on internet. I was shocked to find that there was no cure for any ailment. All my life I used to believe that doctors can cure any disease. Now it was only health and nothing else. I thought if I am healthy, I can earn money for 3,040 more years. Otherwise I will end up spending all money on doctors and hospitals. Today I am 100% fit. No health issues. I can work for 16 to 20 hours a day. I did not spend any money on my treatment. To cut a long story short, I experimented on hydration, dehydration cycles and found that these can cure any disease. I found that dehydration is equally important along with hydration. If anyone wants to get 100% relief from acidity without any medicine in 48 hours. Day 1. Drink 100,200 milliliters water every hour from 7 a.m. to 6 p.m. Day 2. Do not drink any fluids. Or drink as little as possible. If you find it difficult to stay without water and other fluids for 36 hours at a stretch, minimize your water, fluid, intake on this day. You may not get 100% relief in 48 hours in case you could not stay without drinking water on day 2. But repeating day 1 and day 2 every week will give 100% relief in a month or so. Thereafter every month repeat day 1 and day 2. As things progress, you may repeat day 1 and day every time there is change in the temperature of more than 10 degrees centigrade. An interesting story. I was discussing my experiences of hydration/dehydration with a group of yoga instructors. During the course of discussions the yoga instructors mentioned that they suffer from acidity in a big way. I was surprised. I could not answer. But I kept looking for an answer. Later I found an answer to the acidity problem of yoga instructors. Yoga has some breathing exercises. During these breathing exercises CO2 is exhaled. CO2 is slightly acidic. When a person starts yoga, he feels overall improvement. Most of the well-to-do people have acidic buildup in their body. By doing breathing exercises, the acid load of the body starts reducing. In few months the person recovers from acidic body. Now his body becomes too alkaline. The acidity problem is faced when there is acid buildup or alkaline buildup. Later I asked the yoga instructor to stop drinking water for 36 hours. I also suggested him to stop yoga for 7 days. After 36 hours he was completely cured of his acidity. To me, pure means no restrictions of meals. Once a person is cured of acidity he can eat any oily thing in any quantity. Not that I recommend such poor choices of food. But that is the meaning of cure to me. And one must indulge in such things once in a while.